Hi everyone, Dan Julian here, nurse practitioner for Danesthetics Medical Design, and this is our clinic here in Ottawa, Canada. Today we're finishing off the three-part series of a full face rejuvenation, and I'm going to be talking about how I go ahead and treat the lips, the marionettes, and the chin for this lovely client. Let's get into it. Alright, so to begin, let's treat the lips, but before we do, you need to understand how these arteries work. There are three that you need to understand. The facial artery, which starts here, and it's tortuous. It's moving side to side and it runs deep, and it branches off to the superior and inferior labial arteries, which are also deep and also tortuous. Now, why are they tortuous? The reason why they're tortuous is because it needs room to move. If these were straight arteries and I opened up my mouth, that artery would likely pinch off because there's not much room there, and it may cause some blanching. So it's just a safety mechanism. The other thing you need to note is this placement of the facial artery and where it branches off. This area right here is called the modiolus. It's basically an area where you have a bunch of muscles, ligaments, and arteries that all connect into one. And if you feel it, you can feel it's kind of like firm here. And that's where everything's all branched together. Don't put your entrance of your needle here. I'm doing a cannula technique today, so I'm going to show you guys where I put my introducer or where my needle starts. And it's always 4 millimeters from the oral commissure. And it's because that modiolus usually runs about 1 to 1.5 centimeters lateral of the oral commissure. So I'm going to stay within there, and it's going to prevent me from having any bruising. So I have my introducer make a little point within 4 millimeters of the oral commissure. Then I'm switching to a 25 gauge cannula. I prefer a longer cannula, which is 50 millimeters. And what I'm going to do is bring it right to the cupid's bow, and I'm going to do a linear thread, retrograde that thread all the way till about 1 centimeter of the oral commissure. I don't place anything within 1 centimeter of this corner here. And the reason why is because I try and stay with that natural look where most of the volume should be the width of the nose. Okay, next we're moving on to the marionettes. Now, she didn't really have severe marionettes. For her, she just has a little bit of a hollowing right here, and it's causing a little bit of a downturn of the corner of the mouth. And that's likely because she's lost a little bit of volume. And as a result, that muscle tends to pull a little bit more, which is her DAO. So what we can do is I'm going to place a little bit of filler on top of the DAO, and that's going to relax the DAO, and it's going to kick it up a little bit. I don't need a lot for her. I'm just placing a little bit of volume right here in the corner. All right, so now we're getting into the chin. Chins are one of my favorite things to treat. They look extremely simple if you're just looking at someone doing it, a couple pokes and it's done. But there's a lot of measurements involved because some clients may not be a candidate. Sometimes you're going to either masculinize them, sometimes you're going to make them look worse, maybe elongate their face too much. So I have to make sure that they're going to be a good candidate for it. And the way I do that is I actually take out my golden ratio caliper here and I do a few measurements. The first one is I want to see how much projection do they have. Ideally, this chin should hit the lower lip. So if I bring my face to the side and my chin is retruded, if it is retruded, then I know I can bring it a little bit forward. So then what I'll do is I'm going to use the rule of thirds. And the rule of thirds in art is basically this part of the face, which is your hairline, to the mid part of your eyebrows, should equal the distance of the eyebrows to underneath the nose, should equal the distance from underneath the nose to the chin. If they're a little short, then not only would I project it forward, but I can project it forward using an angle. And instead of going straight, I can actually go this way. So I bring it down and I'd add some projection going that way, where I would actually get some projection and some length. The last thing is how wide am I gonna go with the chin? Well, with the golden means caliper, basically the one, which is your intercanthal distance, if I want to feminize her chin, then what I can do, or if I want to elongate it and keep it feminine, then I want to kind of respect this ratio. All right, so now that I have all my measurements in check, which is my tool of preference? Am I going to use a cannula or am I going to use a needle? Well, let's just recap here. If I use a cannula, I'm going to come from the side, place a bolus here, and I'm going to do the same thing on the other side. The issue with the cannula, and I love a cannula, I use a cannula for 98% of my procedures on the face, but for the chin, sometimes I feel that muscle causes a little resistance and it wants to flatten out the filler, and at the same time, if there's like a path of least resistance, it's going to take it. And that cannula actually creates a little channel, and it's a possibility that filler may go back a little bit and it may flatten out. So I prefer using a needle. And that artery, the submental artery, runs up through the chin, and it connects with the inferior labial artery. But most of the time, it's going to run a little bit more on the superficial side. It's extremely rare that it's going to be hugging against the bone. So what I'm going to do is I'm just going to make sure that I'm keeping my needle deep, and I'm going to place, 3 pokes here. I don't want to keep it too pointed. I want to blend it nicely, a nice smooth rounding. And just like that, we are done. The 3-part series is complete. Stay tuned for our next video. Until the next time, take care of yourselves, exercise daily, and please be nice to absolutely everyone. Take care.